Hello, my friends. My name is Jessica Friedman. I am the founder of Mama Shakti. Mama Shakti means Mama Power. Today's practice is a 10-minute prenatal yoga for bed rest. And this practice is really great if you have been put on bed rest, but your doctor has approved you for some gentle exercise, some gentle movement like walking and day-to-day activities. However, you still want to run this practice by your physician or your midwife prior to doing it. Everybody has different reasons and different circumstances for why they were put on bed rest. So please check with your physician prior to doing this. This is a very gentle, restorative prenatal yoga practice that we're doing completely in our bed and not getting out of bed at all for. And all you need are a couple of pillows, one firm, one softer, and we're good to go. So we're going to start with a breathing practice. And for this breathing practice, I like to sit in a modified hero's posture, which is on the knees with a pillow in between my hamstrings and my calves. Now this provides a little bit of extra support for us to sit up nice and tall, for our spine to be nice and long. And if it's not comfortable to sit on your knees, you can just sit crisscross applesauce on this same pillow. You want to sit on your firm pillow so it gives you that lower back support. We're going to start with our hands on our ribs, relaxing our shoulders, and the hands on the ribs helps to bring that tangible awareness down to your lower body. So I've noticed a lot of clients, especially when they're not moving around and not having the same kind of day-to-day activities that they normally do, they can tend to become chest breathers. They're a little anxious, they're a little worried, and the breath becomes a little more shallow and just breathes down into this area of the body. So we want to encourage the breath to continue to come down through the rib cage, down into the abdomen, and get that full diaphragm breath. So we're really working our primary breathing muscle, the diaphragm. So this is going to remind us to bring that breath down, the hands on the ribs, and they might be out here depending on the size of your baby bump, and that's okay. We want to just be able to feel this movement in and out of the rib cage and of the belly as we breathe in and out, in through nose, out through mouth, like you're blowing out a candle. So it'll look like this: in through nose, out through mouth. Very good. Now notice as I breathe in, my hands kind of come out a little bit, and as I breathe out, my hands come back in and toward my midline, and that's exactly what we want. We want that big expansion of our rib cage in through nose, out mouth. In nose, out mouth. 3 more breaths. In nose, out mouth. In nose, out mouth. Beautiful. 5 breaths total at the beginning of the practice, and 5 breaths at the end of the practice will really help keep your diaphragm functioning strong and well for you. All right, so we're going to do a total of 5 movements, and they're very gentle once again, but remember, if anything at any point in time feels uncomfortable or makes you feel any sort of pain, please don't do it. Skip that movement altogether, just to be on the safe side. All right, so the first movement that we're going to do is we're going to sit on our bolster and bring our feet out in front of us, if you haven't already, in that crisscross applesauce position. And we're going to find side bends. So up and over on the inhale and the expansion of the rib cage, and then exhale as you melt down over the head. Very good. Inhale up, exhale down. You can continue that in through nose, out through mouth breath if that suits you. And if it feels really comfortable to hang out on one side and get a little bit of a deeper stretch through your side body, please do. Very nice. One more. And up we go. Excellent. We're going to stay right here and go into some seated circles. And this is what I like to call lubricating the spine. So we're really working on finding that nice spinal mobility, not just through the lower and middle spine, but through the upper spine and even the neck, if it feels All right, on your neck to kind of get some movement in there, you can do that too. Circling nice and slow. The slower the better with some of these movements, in my humble opinion. It really allows you to connect or unite your breath with your body movement. And that is kind of the main purpose of yoga, is to slow down, connect the mind and the body with the breath, and reverse and take it the other way. Very nice. All right, excellent. Great. All right, so our next movement, we're going to do a hip stretch and some glute stretching too. So we're going to come back, and you can use the pillow if you want. I use my arms for support because it's just a little more comfortable for me. We're going to bring our knees out in front of us with a little bend in them, feet flat on the bed. We're going to start by bringing the left leg up and over. Now, if that's too much, slide your right leg out and just cross the left leg over the right like this, like you're comfortably crossing your legs in a chair. And then if you don't feel much of a stretch through your glutes or your bottom muscles, that's when you can bend the knee and bring the leg a little closer to the body, leaving plenty of space for baby and belly. Now, if this feels all right and you want a little movement, you can just gently rock the leg side to side, and this will help lubricate those hip joints, moving our femur bone or the upper thigh bone in the hip socket as we're simultaneously stretching our glutes, maybe even up into your low back a little bit. And I like to suggest holding these stretches and movements for 3 to 6 breaths, which is about 30 seconds to a minute. So when you're done with that side, we'll uncross, cross the other over. Remember, if this is too much, leg slides out straight, and then we find the stretch right there. We all have different body patterns. We all have different flexibility levels. So just go with what feels supportive to you right now. If it feels okay, gently rock. Very nice. And breathe. All right, and then we'll uncross. Very good. And then we're going to come to a sitting on the bolster once again and bringing the soles of the feet together into what is called a bound angle posture or a butterfly posture. But we're not going to flap the legs. We're just going to work on finding some seated cat-cows. So we're going to hold on to our ankles or the front of our shins, and we're going to look up to the sky. And then we're going to curl our spine in a C, bring the chin down to the chest, try and get the biggest C curve of your spine that you comfortably can, and then arch your back and look up to the sky, and just keep that nice, gentle movement of your spine as you come down and up, and breath is steady. Very nice. Good. All right. 2 more movements. We have a little pelvic tilting movement, and this one can be done in a tabletop position. And to take a little pressure off the belly, we're going to bring a bolster or our pillow under our hands, and we're going to focus this movement on our pelvic girdle right here, so our lower spine. So we're going to tuck the lower spine under like you're trying to bring your pubic bone up to your chin, and then we're going to untuck. Tuck, untuck. So this is a little different than cat-cows because we're just focusing on the lower spine. And nice and slow here too. Tuck, a breath, and then untuck, a breath, tuck, and untuck. Very nice. Working on lengthening pelvic floor muscles and working on that lower spinal mobility. Very good. All right. So last movement is a hamstring movement, hamstring stretch. So we're going to open our left leg out with our right foot tucked into the inner left thigh. And we're going to bring the bolster on top, or the bolster or the pillow on top of the left leg. And then you're just going to gently twist just a little bit so your chest lines up with your leg and your bolster. And there's still plenty of space here for your baby and your belly. And if you need to slide that out a little bit, please do. And then you're just going to forward fold over your props. Now, if you find that you can't fold down that far and you need a little more support, grab another pillow, stack it on top, bring the bed up to you as opposed to forcing yourself down to the bed. And maybe you notice as you sit here and lay here after a few breaths, you start to feel those leg muscles, the hamstrings lengthen, and your upper body kind of relax with more ease over your lengthened leg. And then we'll slowly roll up, and we'll do this on the other side. So right leg opens, left leg comes in, and we're going to take the bolster onto the right leg and do the same thing. So just twist slightly over to your right so your chest lines up with your leg and your pillow, and then you're going to fold down over here too. And so we're going to spend about 3 to 6 breaths here. Inhaling nose, exhaling mouth, nice and gentle. One more breath. Very nice. And then slowly coming up, and we'll come into either that seated crisscross applesauce position on our bolster or in our modified heroes for those last 5 breaths. So relaxing your shoulders, hands to the top of the rib cage here and right under the bra strap. And we're going to inhale nose. Exhale mouth. Inhale. Exhale. Inhale. Exhale. Inhale. Exhale. Wonderful. Great job. Remember, this practice is very nurturing. It is very restorative in nature. However, you always want to run new things by your provider, your prenatal provider, prior to doing them, especially if you've been put on bed rest for a medical reason. So thank you so much for joining me in this practice today. My name is Jessica, the founder of Mama Shakti Prenatal. Mama Shakti means Mama Power. Thank you.